Hello, I'm Dr. Kieran Soda. This video is all about lifestyle during pregnancy, including what you can and can't do. I've split this video into two sections. In the first section, I'll be talking about alcohol, smoking and drugs. In the second, sex, exercise and travel. Let's get to it. There is no amount of alcohol that is definitely safe in pregnancy, so the only safe thing you can do is to stop drinking completely. If you don't, you increase the risk of your baby developing fetal alcohol syndrome, which can cause a variety of long-term problems for your baby. Most people know smoking can be harmful in pregnancy and for babies. The effects include increased risk of miscarriage, low birth weight, early births and cleft palate. If you do smoke, it's really important you stop throughout your pregnancy. If you're trying to stop, help's available through the NHS Stop Smoking programme, and there is also a Pregnancy Stop Smoking Helpline number in the UK. Your GP, midwife or pharmacist can also help, so talk to them as early as possible. You should also refrain from using drugs, as they can have very serious long-term effects on your baby. This also applies to legal highs, as these are not regulated, so there is simply no knowing the damage they could cause to you or your baby. It's good for you and your baby to continue exercising whilst you're pregnant. It'll help your body manage with physical changes, and evidence shows it may actually reduce the risk of any complications in labour. It's safe for you to do most forms of exercise, as long as there is no risk of you being hit in your tummy. Ideally, you should avoid contact sports like rugby, and vigorous racket sports such as squash, but it is perfectly safe to run. It's also important to avoid exercising at high altitude, that's anywhere 2,500 metres above sea level, unless you are acclimatised. Also, you should avoid scuba diving, as your baby will not be immune to the risk of decompression sickness. There are specific exercises in pregnancy that you can do to strengthen your pelvic floor muscles, which are important as your pelvic floor muscles help to support your baby during pregnancy and can reduce the risk of problems with incontinence, which can sometimes occur once you've given birth. Your midwife will be able to give you more advice on specific pelvic floor exercises. Some couples worry about having sex in pregnancy, but the good news is it's safe to do so. However, if you do experience any bleeding, speak to a healthcare professional as soon as possible and avoid having sex until they've confirmed it's safe to do so. It is safe to fly for most of your pregnancy, providing your pregnancy is progressing normally. Most airlines will allow you to fly until you're 36 weeks pregnant, or 32 weeks if you're expecting twins. You should, of course, contact your airline to check if they will allow you to fly, and also whether they require a letter from a health professional about your pregnancy before you book any flights. You should be aware that there is an increased risk to pregnant women of developing blood clots when flying. To reduce this risk, you should do small exercises to encourage blood flow in your legs during flight. Airlines usually give good information on this, but please see the links below. Also consider wearing stockings during the flight, as these can help reduce the risk of blood clots. Driving is generally safe, just make sure that you place a seatbelt above or below the bump. So that's all you need to know about how pregnancy affects your lifestyle. My next video is about financial help and maternity rights in the UK, and you can click here to watch that. We've got loads of other videos on pregnancy, so hit subscribe and check them out.